Hi, I'm Cortland and I'm here at the San Antonio Breast Cancer Symposium 2016. I'm sitting with Dr. Sylvia Adams. Thank you so much for joining us
Sure,
today.
my pleasure.
So there's a clinical trial that you are investigating, and you and I are currently talking about participating in it regarding a bone cancer medication to prevent metastases in women with early breast cancer. Can you talk to us a little bit about that study?
Sure. So there are several approaches how you can try to stop metastatic spread for breast cancers. And we know this is a process that actually occurs relatively early. So even a few millimeter-sized tumors can already spread via bloodstream to other organs. And then these are the reasons why recurrences happen. So there are certain profiles in cancer cells that make those tumors more prone to be able to enter a blood vessel and to spread to distant organs. So one of those has been shown in animals and in vitro studies to be breast cancer cells that have a receptor rank on them. And if there is rank ligand, which can either be secreted by other cells, by breast cancer cells, or by immune cells in the area, that ligand, once it binds to the rank receptor on breast cancer cells, they become more motile. They can actually now infiltrate and metastasize. So in mouse models, this has been established. And it was not just metastases to the bones, but also to lung tissue, for instance. And if you gave mice the antibody that basically neutralized the ligand, you could prevent the metastasis into the lung. So there are now studies. There is actually one large trial that was completed years ago now, which is called DCARE, that looks at the efficacy of these drugs to push out the event of recurrence in women with early breast cancer. And in that trial, the drug, denosumab, was given mostly after surgery, immediately after surgery for a longer period, but also in some women along with neoadjuvant chemotherapy. The results are still pending, so we don't know yet if this is a successful trial, meaning that metastases are being inhibited. But what we are doing in our trial is basically trying to evaluate what the biological effects are of the drug in the breast tumor. Because once a patient undergoes surgery, you really cannot follow changes in tumor cells that are induced by this drug. So we are using the biopsy tissue from a woman that was obtained for diagnostic purposes, and then the surgical tissue as a paired sample. And in between, the woman receives one dose of the denosumab drug in between. And we are evaluating changes in the breast cancer cells, in their rank expression and their proliferation, in their ability to metastasize. And also, my main interest is the immune changes in tumors, in tumor beds. So we're also looking at how the rank ligand inhibition affect the immune microenvironment in the tumor. And interestingly, at this conference, there was also a presentation on how this drug can not only inhibit metastases, but also inhibit the development of breast cancers in women who carry the BRCA1 mutation. And what they just showed is that in some in women who have BRCA mutations, that in their normal breast tissue, you have cells that carry the rank receptor that are more prone to develop cancer. And if you actually are able in mouse models to give them the rank ligand inhibitor, you decrease that chance and you decrease the proliferation of those cells, and making this drug a potential prevention drug too for BRCA carriers. And as the speaker mentioned, there will be a large national or international trial that is going to be randomized for women without cancer but carrying a BRCA mutation to see if a 5-year treatment with denosumab will be better than placebo to prevent cancers. Mm-hmm. But our study is very simple. It is one dose of denosumab given prior to surgery in women with early breast cancer. And we will evaluate what the biological changes are. So basically look at the pharmacodynamics of the drug to see what changes are happening.